Trevor, do you consent to be my volunteer patient for this exam?
I do.
Okay. We have already done introductions and I have done hand hygiene, and now we'll begin. Looking at the skin, his arms are warm and dry. They have no lesions or abrasions anywhere that I can visualize on his skin. His nails are free of clubbing or cyanosis. There is no discoloration or any deformities. The capillary refill is less than 3 seconds. It is nice and brisk, which is a normal finding. Moving on to the head assessment. From an appearance, just inspecting, there is no edema or deformities. I don't see any lumps, bumps, or masses that are visualized just by inspection. I'm going to do a further inspection by looking at the scalp, looking for flaking, infestation, nevi, lesions, lumps, or bumps. I don't see any of those. I do notice that the hair pattern lacks any signs of male pattern baldness. There is a normal texture. This looks like a normal finding here. I'm just going to palpate for tenderness. Please let me know if you feel any.
No tenderness.
Great. Moving on to the face. Our eyebrows are equal, symmetrical, and the hair distribution is full through the lateral edges. There's no infestation. For our eyelashes, we have a similar finding. The hair distribution is even all the way to the edges, and they are full. There is no infestation there. For the eyelids, there's no edema. There's no edema of the lacrimal glands. The sclera and conjunctiva are free of injection. Our pupils are round and equal bilaterally, and they are 4 millimeters in size, which is a normal finding. When looking at the orbital area, there are no external growths or anything else that would be a concerning finding. I am now going to palpate the eye and lacrimal area and the orbital area and just palpate for any tenderness. Let me know if you feel any tenderness. Anything there?
No.
Okay. I am now going to palpate the frontal and maxillary sinuses. Any tenderness there?
No.
Okay, perfect. I'm now going to move on to an eye exam with my otoscope. The room light is dim. It is set to 0 diopters, and I will be doing unilateral assessments for this exam. So anything that I would do for the eyes, the ears, the nose, as well as the peripheral vascular assessment would be repeated bilaterally, but for this one, I will just be working on the right side. I'm going to look for the red light reflex, come from about 12 to 18 inches away, look into your eyes. That is a positive red light reflex, which is a normal finding. I am now going to do an exam of your optic disc. Please just look forward, and I'm going to look here. All right, the optic disc has sharp margins. There are no abnormal findings. There's no edema. The retina is free of AV nicks, hemorrhages, or cotton wool spots, and that is a normal finding of the eye. I am now going to do tests of your vision. The first thing I will do is use my pen light to look for consensual and direct reaction to light. So when looking at the left eye with the light, it constricts, which is normal, and then the same with the right, it constricts. They both have a direct reaction and accommodation to light. Now I'm going to look for consensual reaction. So with light on the left, the right constricts, and with light on the right, with light on the right, the left constricts, and with light on the left, the right constricts, which is a normal finding. I am now going to use this pen to do an ear test. So if you could look at this pen and then follow it as it goes in towards your nose. Perfect. His eyes constrict and accommodate for that, which is normal. I'm now going to do an H test. So I'll have you keep your head still and follow this pen for me, please. Great. There are no signs of strabismus or nystagmus, which is a normal finding there. I am now going to do the liquid test. I am going to stand here, and I just want you to tell me which finger is moving without moving your head. Perfect. Our visual fields are intact. Moving on to an inspection of the nose, the inferior and anterior aspects are intact. I see no drainage from this perspective, and I'm going to do an internal exam with my otoscope. Okay. Looking at the right nair, there's no drainage, and I'm going to go into the nair. All right. Great. Our septum is free of deviation and perforation. There is no drainage noted. The nasal turbinates are pink and moist, and that is a normal finding for that exam. Moving on to the oral cavity, the lips are pink and moist. I'm going to have you smile for me. Great. And open your mouth. Perfect. The teeth are all intact. There's no signs of notching or erosion of the teeth. The gums are pink without any bleeding, ulcerations. There's no signs of gingivitis or any abnormal growths. I'm going to look at the top palate of your mouth. Great. And I'm going to now have you lift your tongue, and I'm going to look at the bottom palate. Fantastic. Both palates of the top and bottom of the mouth are free from ulcerations or any bony growths or prominences. And if you open your mouth, and I'm going to look at your buccal mucosa, you can put your tongue in. Perfect. Great. Looking at the buccal mucosa, it is pink and moist. There are, again, no ulcers, no lesions, and they are intact. I'm now going to have you open your mouth, look at your tongue, stick your tongue out. Great. All right. The tongue is pink, free of any ulcers or abrasions. The papillae is distributed evenly. There's no erythema. The tonsils are removed, but the uvula rises symmetrically with the soft palate, and the pharynx is pink and moist with no ulcers or erythema. That is all normal findings for your oral cavity. Moving on to the ears, I am going to do a series of tests to test for any tenderness. Just looking at them bilaterally, there is no erythema, there's no abnormal growths on the outside of the ears, there's no drainage that can be seen, and there's no edema. I'm going to do a tug test and pull back on your ear. Do you feel any pain there?
No.
Okay. Now I'm going to press on your tragus. Do you feel any pain there?
No.
Okay. I'm pressing the mastoid. Do you feel any pain there?
No.
Okay, great. I am now going to turn on my otoscope, and I am going to look in your ear, pulling up and back for the tympanic membrane. All right, fantastic. I see no drainage. The tympanic membrane is free of effusion, edema, any bullous membranes, and there's no effusion. I can see the bony prominences, the incus and the malleus. I see the cone of light at 5 o'clock, which I would expect for the right ear, and I would expect it at 7 o'clock for the left ear. And that is a completely normal finding of the ear. And then I would repeat that on the other side. I am now going to do an inspection of your throat externally. Looking at your neck, I do not see any jugular venous distension on either side. The trachea is midline, and I do not see any edema of the thyroid. I am going to give you a glass of water, and I will just have you swallow. Great. I am now going to palpate from a posterior position, and okay, all right. I am going to have you swallow again. Great, okay. I am displacing the node to the left, to the right. I feel both lobes and the isthmus right below the cricoid cartilage. I do not feel any nodes or lumps on the thyroid, which is normal, and there are no nodules, and then there is no edema or goiter, which is, again, a normal finding. I'm now going to palpate the cervical lymph nodes of the head and neck. I'm going to do the submental, submandibular, tonsillar, pre-auricular, post-auricular, anterior cervical chain, posterior cervical chain, occipital, deep cervical chain, supraclavicular. Did you feel any tenderness for that?
No.
Okay, I did not feel any nodes or masses, which is a normal finding. I am going to do one hearing test for you now, and I'm going to stand behind you an arm's length away, and I am going to exhale and whisper a combination of letters and numbers, and I will just have you repeat back to me what you hear. I will have you press your left hand over your tragus, blocking your ear, and make sure you're only hearing out of the right. And take a big deep breath and exhale. 4K2.
4K2.
Perfect. That is a normal finding. Hearing is intact on this side. Now I'm going to move on to the cardiac assessment. So I will first have you lay back. Thank you. All right. I am going to now auscultate the carotid arteries. I want to auscultate first before I palpate to make sure that I don't hear a presence of a bruit, because if I did, I would then not palpate that area. I do not hear a bruit there, so now I'm going to palpate. +2 on the right and +2 on the left. That is a normal finding. I'm now going to inspect the precordium, and I do not see any abnormal findings here just upon inspection. I am now going to palpate for tenderness. Any tenderness there?
No.
Okay. I will now be doing a series of assessments across the precordium for the cardiac assessment. I will start with lifts and heaves, then thrills, following with auscultating for heart sounds, rhythm, and rate, and then I will auscultate for murmurs. These will be across the landmarks of the chest, the aortic, across the right sternal border at the second intercostal space, the pulmonic, which is at the left sternal border in the second intercostal space, Erb's point, which is across the left sternal border in the right intercostal, or the third intercostal space on the left sternal border, then the tricuspid, which is again on the left sternal border at the fifth intercostal space, and then the mitral valve, which is at the fifth intercostal space at the left midclavicular line, and then I will also listen in the epigastric area. So that is what I will do for the following series of assessments. So with the ball of my hand, I will palpate for lifts and heaves, aortic, pulmonic, Erb's point, tricuspid, mitral, gastric. All right, and then with the ball of my fingers, I will now palpate for thrills, aortic, pulmonic, Erb's point, tricuspid, mitral, gastric. Fantastic. I do not feel lifts, heaves, or thrills. I am now going to continue with the auscultation here. Great. Listening to his heart, he has a normal rate and rhythm. There are no extra heart sounds. His rate is between 60 and 100 beats per minute, which is normal for an adult. I listened at the apical impulse, which is at the left midclavicular line, fifth intercostal space, and that is where I listened to his rate and rhythm. I am now going to switch the bell and listen for murmurs in those same spots. Okay, I do not hear any murmurs, which is again a normal finding. I will now have you turn on to your left side, and that will allow your body to accentuate any murmurs that you may have. So I will do that. And although you cannot see, I will be again doing the same points for my assessment here with the bell. I still do not hear any murmurs, which is a normal finding. I am now going to palpate for the PMI along your precordium, and great. And I again feel that at the 5th intercostal space along the left midclavicular line. That is all normal. I will now have you sit up for the last portion of the cardiac exam. Thank you. I am going to listen for an aortic murmur. What I will have you do is lean forward slightly, exhale, and I will listen down the left sternal border into the epigastric area, making sure to listen at Erb's point and listen for an aortic murmur. All right, you can exhale. I do not hear a murmur, which is a normal finding. I am now going to proceed with the respiratory portion of the exam. I'm going to assess for tactile fremitus. So I'm going to have you say 99 3 times.
99, 99, 99.
Great, and I'm using the ulnar surface of my hand for that. I am now going to percuss the areas of the anterior chest. So. Great, and I hear resonant sounds, which is a normal finding. I am now going to auscultate the anterior portion of the chest. And again, with his breathing, I do not see any increased work of breathing, any respiratory distress. There's a normal rhythm to his breathing. He does not have any abnormal respiratory findings upon inspection, and his respiratory rate is about 16, which is between 12 and 20, and that is normal for an adult. So I will now auscultate these areas. Big deep breath in through your mouth and out, please. Great, and that is all normal. Vesicular breath sounds throughout. I will now have you turn around, please, and I will do the posterior portion of the exam. All right, so again, I am going to assess for tactile fremitus, and I'm going to use the ulnar surfaces of my hands, and I will have you say 99 3 times.
99, 99, 99.
Great, that is a normal finding. I will now percuss. Great. I hear resonant sounds, which is all normal. I am now going to percuss for diaphragmatic excursion, and I'm going to have you take a big inhale and hold it. Okay, and now I'm going to have you exhale. All right, and from here to here is the diaphragmatic excursion. That is about 4 centimeters, which is a normal finding. I am now going to auscultate the posterior thorax for breath sounds. So I am going to have you take a big deep breath in and out through your mouth. Good. Great. I hear bronchivesicular breath sounds in the first and second intercostal spaces between the scapula. Bronchivesicular, however, I hear vesicular throughout the rest of the lungs, which is a normal finding. I will now have you turn towards me again, and I will conclude the exam with the peripheral vascular section. So I will be doing this again unilaterally, even though I would do it bilaterally. So I'm going to take your hand, palpate a radial pulse +2 and an ulnar pulse +2, a brachial pulse, which is +2. I will defer the femoral pulse as of now. I will have you move your leg out. You can, yeah. Great, popliteal +2, dorsalis +2, posterior tibial +2. And looking at his legs, they are warm, pink, dry. There is even hair distribution throughout the bottom of the leg. and we do not have any concern for arterial insufficiency here. And then the last thing I'm going to do is measure your jugular venous distension. So I will just have you lay back. Using these cards, I'm going to put my card at the angle of Louis at the top of the sternal notch, and then I am going to look for auscultation, and I am going to measure from there. It is 2.5 centimeters, which is a normal finding. And then that concludes our exam. Thank you for being my volunteer patient.
Thank you.